Welcome to the YMCA of Greater Kansas City Benefit Information Presentation. The YMCA is proud to offer a well-rounded core benefit program including medical, dental, life, and basic vision, as well as flexible benefit plans, sometimes referred to as a cafeteria plan. As you will see throughout the presentation, the YMCA recognizes the diversity of our associates and offers a wide selection of medical options designed to meet the varying needs of our associates and their families. In addition, the YMCA works with Benefits Direct to offer supplemental benefits available at very competitive prices with favorable underwriting not available to the general public. This allows you to custom tailor a benefit package that best fits your needs and your budget. The purpose of this presentation is to briefly overview the benefit offerings contained in your associate benefit folder for your enrollment. Benefits Direct can answer questions you may have and assist you in enrolling in the coverages that you choose. If you intend to enroll any dependents in medical coverage, please be sure and have your dependent Social Security numbers ready for your enrollment, as they will be required by the medical plan. The available benefits that we'll be talking about in today's presentation are as follows: health insurance, dental and vision coverage, health savings accounts, as well as flexible spending accounts, dependent life insurance and voluntary life insurance, short-term disability coverage, cancer and intensive care coverage, accident coverage, permanent term life and long-term care coverage, and legal shield and identity theft protection. There are three medical plan options through United Healthcare's Choice Plus network that we'll review. The first option is called the Network 1000. You can see preventative services are covered at 100% with no copays or deductibles. The copays are listed on this slide. Notice the deductible is $1,000 for individual and $2,000 for family, hence the name Network 1000. Coinsurance, the employee will pay 20% up to $4,500, then the plan will pay at 100%. The next plan is the Network 2000. You'll notice there's two changes here with the deductible and the coinsurance. The deductible for an individual is $2,000, family is $4,000, and the coinsurance is set where the employee pays 20% to $5,500. The third plan option is called the High Deductible Health Plan 2500. Preventative services are covered at 100%. However, the deductible for an individual is set at $2,500 and a family is $5,000. Please note that for family enrollment, the full family deductible must be met before any benefits are paid out on this plan. Once the deductibles have been met, all covered services are paid at 100%. If you choose to participate in a high deductible health plan, then you qualify to participate in a health savings account. Your contributions to a health savings account are tax-free. The earnings can grow tax-free and the money can be withdrawn for eligible expenses tax-free. The savings are always owned by you and are immediately available to you for eligible expenses, or you can save funds for future use. An HSA is designed to give you greater control and choice in managing your healthcare expenses. Again, the HSA is always yours, even if you change jobs, re-enroll in one of the traditional plan options, or become unemployed or retire. Again, to be eligible for an HSA, you must be covered by the High Deductible Health Plan 2500. You also cannot have any other coverage such as what is listed on this slide. Ultimately, the account holder is responsible for maintaining compliance under these regulations, so if you have questions, please ask your Benefits Direct representative. The rates per pay period for the medical plans we've reviewed. This information will also be in your benefits packet. If you need to spend some time on this page or go backwards, you can push pause, rewind, or fast forward throughout this presentation. If you don't qualify for an HSA, an FSA may be an option for you. There are two types of flex spending accounts at the Y: medical reimbursement and dependent care. Flexible spending accounts allow you to set aside money from your paycheck on a pre-tax basis to pay for medical and child care expenses. That means you don't have to pay federal, state, or FICA taxes on those dollars, which means more money to you in your pocket. With a medical reimbursement FSA, your annual contribution is 100% available day one of the plan year. The new maximum contribution per IRS regulations per year on this plan is $2,550. This slide shows a very short list of eligible and ineligible expenses for a medical reimbursement flex spending account. Eligible expenses that are commonly used for things as copays, deductibles, medical office visits, prescription drugs. Ineligible expenses would be things like insurance premiums, cosmetic procedures, personal hygiene products. The second type of flexible spending account that is available to you is a dependent care FSA. Again, it allows you to elect pre-tax dollars to pay for eligible dependent daycare services generally used for work-related child care expenses. But you can also use these funds to pay for work-related expenses for older tax dependents who are not capable of self-care. The $5,000 per household is the calendar year maximum set by the IRS. This slide shows a short list of eligible and ineligible expenses for dependent care services. Eligible expenses are such as daycare expenses, before and after school care, nanny expenses. Ineligible, over on the right, are things such as tuition or transportation. Tied to all YMCA medical plans is the iMed Vision Care Network. Notice the coverage and discounts listed below. In addition to this vision plan, if you would like to purchase an additional voluntary vision plan through Humana, that information is included with your packet of material. Here is the additional vision option through Humana. You can see there is a $20 copay for exam and materials. Then frames are covered at a $45 wholesale frame allowance every 24 months, $150 lens allowance for contact lenses, and then single, bifocal, and trifocal lenses will be covered at 100% after the copay has been met. The dental option at the YMCA is provided by Humana Preferred PPO Dental Network. You can see the network benefits listed below, as well as the rates. Dependent life insurance through Reliance Standard is an option to cover your spouse as well as children for a very small cost of $225 per month. The second type of life insurance available is called voluntary term life, underwritten by Reliance Standard. Do you have enough life insurance? The voluntary term life option with Reliance Standard is a very affordable and simple way to purchase life insurance. On this plan, as an associate, you are guaranteed issue, meaning no health questions, up to $100,000. You can go beyond that. There are some medical questions to complete. You can also cover a spouse or domestic partner up to $30,000 without any questions during the initial eligibility period. There is also an option to cover children for $10,000 of coverage. Short-term disability is underwritten by One America. For most of us, our biggest asset is the ability to come to work and earn a living. Not being able to work due to a disability, having taken away the ability to work, could often be financially devastating. That's the reason for short-term disability, and the reason many people call it paycheck insurance. As an associate of the Y, you can purchase up to $6,000 per month in coverage, not to exceed 60% of your earnings. During the open enrollment period, employees can elect coverage without evidence of insurability, meaning no health questions to you. If you had to utilize this coverage, it would kick in after you've been off work for 14 days. Underneath this plan, partial disability will be covered, as well as maternity. The cancer coverage option is underwritten by Loyal American Life Insurance Company. Why would you need cancer insurance? There are two distinct losses that occur when cancer strikes. The first and most obvious are direct medical expenses from a hospital or a doctor. That is what your health insurance is designed to take care of. It's the indirect and non-medical expenses, according to the American Cancer Society, that take up 66% of the cost of treating cancer today. That's the reason for this type of plan, is to fill that gap. As I mentioned, it's underwritten by Loyal American. They're an A-rated company. Also, there are no coordination of benefits with this plan, meaning it must pay you in addition to any other coverage you have in force. The difference between this and health insurance is health insurance pays doctors and hospitals. This coverage pays you directly in tax-free cash. To obtain this coverage, there is no physical exam required. The coverage is guaranteed renewable for life, and it pays in addition to any other insurance you may have. The policy is fully portable, so you can take it with you if you were to ever leave or retire from the YMCA. We'll review a couple of the benefit options that this plan covers. The first is called the cancer screening test. It'll cover things like mammograms, pap smears, PSAs, colonoscopies. Health insurance is already covering those. However, it'll pay you up to $50 per person per year as an incentive to go get those tests done. If transportation is needed due to the treatment of cancer, this plan will pay actual charges for a common carrier for the patient and one adult companion. Many times today, we see cancer treated on an outpatient basis. If lodging is needed during the time of treatment, this plan will pay actual charges up to $75 per day for a hotel or motel. The surgical benefit pays according to a set schedule of operations, up to $4,000 per surgery and up to $1,000 for the anesthetic that would be used in that surgery. Surgically implanted breast prosthesis would be covered at actual charges. Radiation, chemotherapy, immunotherapy, and experimental treatments are also covered underneath this plan. These treatments will be covered at actual charges up to $10,000 per person per calendar year in or out of the hospital. Skin cancer will also be covered anywhere from $125 to $750 depending on the type of procedure and where the skin cancer is located on the body. There are 18 additional benefits. There are 9 listed on this slide. This slide shows the rest of the additional benefits. Again, please look at the brochure located in your benefits packet for a full explanation of all these benefits. Here are the rates for the base cancer plan through Loyal American. There are 2 optional riders that you can add to the base cancer plan. The first is called the first occurrence benefit. It says the first time an insured person has been diagnosed as having an internal cancer, they will pay a lump sum first occurrence benefit of either $3,000 or $5,000. The second rider is called the intensive and critical care coverage rider. It covers any sickness or accident that would put someone into intensive care with 3 exceptions: an act of war, a suicide attempt, or if you would be out hurt committing a felony. If admitted into the highest level of intensive care, this plan pays $600 a day, every day, up to 45 days per confinement. If admitted into a step-down unit or a lower level of intensive care, the plan would pay at $300 per day. Here are the rates for the intensive care rider. This would be the package if you include the base cancer plan, the $5,000 first occurrence, and the intensive care rider. You can see for an individual per month it is $27.94. You can also select single parent or family coverage underneath this plan. The accident policy is underwritten by Humana. Anyone can have an accident. 1 in 9 Americans receive medical attention for an injury annually. Humana's accident plan provides additional cash directly to you and your family to help offset the expenses that may not be covered by a health insurance plan. With the accident plan, there are no medical exams, no lifetime maximums, it's guaranteed renewable, and again it pays cash directly to you. The Humana accident plan offers 2 different levels, a level 1 and a level 2 option. You can see the first benefit, called accident medical expense benefit, pays the actual expenses for the diagnosis or treatment by a physician or in an emergency room. Level 1 would pay actual expenses up to $500, level 2 up to $1,000. Note there is a deductible if you give treatment in the emergency room. You can also see listed benefits for ambulance, hospitalization, as well as accidental death and dismemberment. It also specifically covers bone fractures and dislocations. It is payable when a covered person suffers one of the fractures or dislocations listed on this page and is already at a predetermined amount. Here are the costs for the Humana Accident Program, which can also be found in your packet. Permanent term life insurance and long-term care, now underwritten by Combined Life, is the third type of life insurance available at the YMCA. We feel that this option is one of the most economical and easiest ways to purchase long-term care coverage. But it also includes life insurance. The first bullet point points out the life insurance rates are guaranteed to age 120, portable, and individually owned. In addition, if you were to ever need long-term care, this plan will pay 4% of the face amount every month for up to 75 months. As an associate of the Y, you can purchase up to $75,000 of coverage with absolutely no health questions during the initial eligibility period. You can go beyond that with 3 questions. You are also allowed to cover a spouse and children on this particular plan. Legal protection plans underwritten by MetLife. According to the American Bar Association, 70% of U.S. households had a need for a lawyer in the last 12 months. The issue is how do you or I know a good lawyer from a bad one? Have you ever known anyone that needed help with a foreclosure, identity theft, divorce, traffic ticket, child support, custody issues, or need a will to protect your family? That is what the Legal Shield plan will provide. When you enroll in MetLaw, you'll be able to get advice on a wide range of legal matters, such as some that are listed on this slide. The plan covers your attorney's fees for these and many other covered services when utilizing a plan attorney. Many families in America may have a new or ongoing legal problem every year. This plan is built to be cost-effective, conveniently payroll deducted, and give you access to a large network of attorneys to choose from. Smart, simple, and affordable coverage. The rates for the MetLaw plan at the YMCA are $24 a month. This concludes your benefits overview at the YMCA of Greater Kansas City. For more detail on these plans, please review your benefits packets, as well as feel free to reach out to a representative from Benefits Direct for questions or for changes. Thank you for taking the time to review the benefit options at the YMCA.